here and do drugs and engage in drug-related behavior. We don't do a good job of as a city measuring that. I have legislation that's coming that's going to require it from some certain departments. Part of the problem is that depending on, there's different definitions for what is a San Francisco resident. In permanent supportive housing, I think residency, or no, I'm sorry, general assistance, it's established in 15 days. There is a way to do a known address history report to measure that. My first job in California was working for the district attorney of San Francisco, a guy named Arlo Smith, who just passed away, but he told me that back in 1990, that the social welfare policy of San Bernardino County is a ticket to San Francisco. When I worked in the city attorney's office under Dennis Herrera, we, just as a fluke, actually caught a psychiatric hospital in Las Vegas, Nevada that was engaging in patient dumping. That over a period of 3 or 4 years, they were putting people on buses and sending them to cities that include San Francisco. No connection to San Francisco at all, just they'll take care of you. San Franciscans shouldn't have to be doing that. There should be consequences for public drug use. That, I think, will be the measure. Ultimately, I think we have to make sure that I think we can do it, and I trust a city that's like the city of St. Francis with our values to do it. But in my view, we have to give people who are coming here to use drugs 3 options: get sober, get arrested, or get out.
So as the chief said, this is really intended to fill the gap between jail and the emergency room and the difficult choice that officers too often have of either arresting someone for public drug use and being subjected to several hours, 4 to 8 hours of paperwork or sitting with someone in a hospital, or being out on the street. And so we're gonna hold ourselves accountable to 3 big metrics. The first is the number of public drug use arrests or instances of public drug uses where there was an intervention. And then once that person is at the center, there's an opportunity to both connect them to treatment, but also to understand if there are outstanding warrants, see if there's an opportunity for relocation assistance if they're not from San Francisco, any number of those things during those 24 hours. Second will be the actual conversions to treatment or relocation, so that next step. And the third is going to be officer turnaround time. We are designing this with a goal of 15-minute turnaround time for officers, because the most important thing we can do is create the capacity for officers to make that arrest, help that person come off the street, but then also get back out on the street so they can continue to be out in the community as was discussed earlier. So those are the 3 big things we're holding ourselves accountable to. It will be contracted through the Sheriff's Department. We are working with to go through a process right now to have a provider that we feel can do this competently. We have a very good sights on a number of options we've been evaluating. This type of work happens in communities around the country, so we're not looking to reinvent the wheel, but this will likely not be a San Francisco provider, but someone who has done this in a national context in other places and has been successful.
What about the Howard area?
We have one across the street from me, the Sober Center right now, which is an epic failure.
Oh, I know. That is a different model. Let me give it to Nick. So we're coming up on the end. Okay, here's Tracy.